My name is Zach, and I'll be your nurse for the day. I'm going to give you a physical assessment today, and before we start, I want you to know that everything between us is confidential, and I can't go tell anybody your business, and I'm going to give you some privacy, so I'm going to close the curtain or the door, and yeah, and you can, if there's any treatment or anything that I, gotta assess or anything that you don't want me to, you can refuse any of it. Just let me know if you get uncomfortable or something. Alright, so now we're gonna start. I'm gonna inspect the skin on your face and palpate it. Is any of that painful, tender, nothing? Alright, the skin looks good. I mean, obviously it's got facial hair, that's normal. Skin's a little red, just maybe sun damage over the years, but it looks, there's no blemishes or lesions or anything noticeable that I should be concerned about. Now I'm going to inspect and palpate his cranium and his scalp and look for blemishes, lesions, nodules, bugs even. I don't see anything. Is any of this tender, painful?
No.
Okay, I don't feel any lumps. His hair is evenly dispersed across his scalp. Okay, looks good. Now I'm gonna come back. Okay, now I'm gonna look at the symmetry and the expression of his face. His head and face is symmetrical, and the expression on his face is normal. Haven't noticed anything that's off-putting since I've been in here talking to him. Now I'm going to palpate his temporal arteries. Okay, it's a +2 on both sides, which is normal. Now I am going to palpate his T and J. I'm going to get you to open and close your mouth for me. I'm going to be feeling for grating and clicking of his jaw, which I do not feel. Okay, now I'm going to assess cranial nerve 5. So what I'm going to get you to do is I'm going to get you to clench down with your teeth. Okay, to clench, I'm going to pull. Okay, now he did it toward resistance, so that's good. Cranial nerve 5 intact. Now we're going to do cranial nerve 5 again, but we're going to do the cotton wisp. I'm going to need you to close your eyes for me. Okay, I want you to say now when you can feel the cotton ball touch your face, okay?
Okay. Now.
Okay.
Now.
Got it?
Now.
Okay, good. Now we're going to do cranial nerve 7. I'm going to get you to smile. Smile. Okay. I'm going to get you to frown. Okay. I'm going to get you to raise your eyebrows. Okay. Now I'm going to get you to close your eyes tight. Okay, good. Now I'm going to get you to puff out your cheek, like put a bubble in it. There you go. Now I'm going to get you to show your teeth, so. Yeah. All right, great. Now we're going to move to the eyes. We're going to test cranial nerve 2 with the Snellen chart. So I'm going to get you to close your right eye with your hand and read the furthest line down that you can.
P, E, C, F, D.
Okay, now do the same thing with the other eye.
P, E, C, F, D.
Good job. Now we're going to test cranial nerve 3, 4, and 6. I am going to get you to follow my finger with your eyes. We're going to do the 6 fields of gaze. Don't move your head though. Alright. Okay, good job. Now I'm gonna shine a light to see the constriction and dilation of your pupils. So I'm gonna get you to just kind of look like straight at the wall for me, if you can. Okay, his pupils are equal brisk, round, and reactive to light, and they're both the same size, about 3 millimeters. I give it about 5 millimeters. Okay, that's good. Now I'm gonna test your accommodation. So I'm gonna get you to follow this finger, or I'm gonna bring it to your nose or whatever. You're just gonna follow it all the way there, okay? Okay, it's got good accommodation. So now I'm gonna look at the external parts of the eye. So I'm gonna look at your eyebrows, and the hair is evenly spaced across it. Is there any pain or tenderness?
No.
Okay, I don't feel any nodules, any lesions. I don't see any bruising, any discoloration of the skin. I'm gonna get you to, just gonna move your glasses down just a hair. I'm gonna look at your eyelashes. Can you close your eyes for me? Okay, his eyelids look good. I don't see any discoloration or any bruising, any type of anything that I should be concerned about. His eyelashes are evenly spaced. The hair across his whole eyelid is evenly spaced. And yeah, it looks good. Now I'm gonna get you to open your eyes. Your eyeball looks good. Doesn't seem swollen. There's no discoloration noted. Okay, good. Now I'm gonna look at the inner part of your eye. So I'm gonna shine the light in your eye again. Okay, I'm gonna look at your iris. You open your eye a little bit. There you go. All right, his iris is nice and blue. It doesn't seem to be any discoloration. It's bluish green. His sclera is nice and white. I'm gonna put on your eyelids. His conjunctiva is nice and pink and moist on both sides, and his cornea is shiny. I don't notice any problems with it. Okay. You alright?
Mm-hmm.
Okay. Sorry I had to blind you there for a minute. Alright, now we're going to go to your ears. I am going to inspect and palpate your ears. Does any of that hurt? Tenderness? None?
No.
I'm going to put your glasses back on. I feel bad. I kind of took them off. Alright. They're pink. I don't see any discoloration. I'm going to check on top of them for any skin damage. No, I don't notice any. I don't feel any nodules. I don't see any lesions. They seem to be. I don't see any problems with them. Alright. Now we're going to do the whispered voice test, which is cranial nerve 8. I'm going to get you to cover your left ear for me with your hand. And I'm going to whisper a word and you're going to repeat it back to me.
Banana.
There you go. Now do it with the other ear.
Apple.
There you go. Alright, now we're going to do your nose, alright? I'm going to move your glasses up just a tad so I can inspect and palpate your nose. Is there any pain?
Mm-mm.
Okay, I don't feel any type of bruising, any nodules. I don't feel any type of, any swollenness. Yeah, I don't notice anything. I mean, it's pink, moist, skin looks good, no discoloration. I'm going to get you to close one of your nostrils with your finger and then sniff. Okay, good. Now I'm going to get you to do it with the other nostril. Alright, good. Now I'm going to palpate your maxillary and frontal sinuses. Frontal we're going to do first. Is that tender?
Mm-mm.
Okay, I don't feel any swollenness in it. Now I'm going to do the maxillary. Is that tender?
Mm-mm.
Okay. Good. Now I'm going to look at your mouth and throat with my pen light. Alright, open your mouth for me, please. Okay, the tongue is nice and pink. Buccal mucosa. Move your tongue down, just kind of like lay it in the back of your throat, I guess. Yeah, there you go. Buccal mucosa is pink. I don't see any type of damage or anything. I don't notice anything out of the normal. Teeth looks good. You can tell he's had some dental work done. Lift your tongue up for me. Hit the roof of your mouth. There you go. Floor of his mouth looks good. Nice and pink and moist. All right, you can lay it back down. All right, now open your mouth again. I just gotta look at the back of your throat. Alright, the palate is nice and pink and moist. Can you go ah for me?
Ah.
There you go. Can you put your tongue down for me again, sir? Like just like regularly open your mouth. There you go. His pharynx is nice and pink. There doesn't seem to be any redness or swelling. His uvula is nice and symmetrical, pink, moist. His palate, just everything looks, I don't notice anything. And for cranial nerve 9 and 10, I just tested his uvula rising. So now I'm going to test his gag reflex, which I don't really have anything for that, but I'm going to test your gag reflex again,
Alright.
so go up. Yep, it's intact. Alright, now I'm going to test cranial nerve 12. I'm going to get you to stick out your tongue for me. Okay, wiggle it left, right, up, down. There you go, it's nice and symmetrical and the function's great. And when I was looking in the back of his mouth, his tonsils, it was a +2. It just slightly came through the bridge. It wasn't too far out, wasn't too narrow, it was just fine. Now we are going to do your neck. So I'm going to inspect and palpate your lymph nodes, okay? I'm going to palpate his preauricular, post-auricular, his occipital, his submental, submandibular, his tonsillar, superficial cervical, posterior cervical, deep cervical chain, into the supraclavicular, and any of that tender, painful, nothing. They didn't feel swollen.
Nope.
All right, now we're gonna do range of motion. I'm gonna get you to bend your neck forward. Okay, there you go. Bend your neck back. Okay, now we're gonna get you to go left to right. Turn your head left to right. There you go. Ear to the shoulder. There you go. Now I'm gonna get you to look at me, and you're gonna turn your head like this. There you go. Now we're gonna go toward resistance. So turn your head one of the ways. There you go. It goes toward resistance. Now we're gonna go the other way. There you go. Toward resistance. All right. Now shrug your shoulders. There you go. Now we're gonna go toward resistance. There you go. That's cranial nerve 11, by the way. And now I'm gonna inspect and palpate your trachea and your thyroid. So just kind of look up just a tad for me. All right, trachea is midline, no deviation. Is any of that painful?
Mm-mm.
Thyroid does not appear to be swollen. Okay. Now I'm going to palpate the carotid artery one at a time. Okay, that's a +2. I'm going to palpate this up. It's a +2. Now I'm going to auscultate for bruise with the bell side of my stethoscope. Oh. And by doing that, I'm looking for like a swooshing, blowing noise, but which I did not hear. Okay, now I'm going to do the posterior lateral chest. All right, I'm going to get you to stand up for me. I can't really do it in this chair.
Okay.
I'm going to move this out the way because the rest of this is not going to be in that chair, sir. All right. Any of that painful, tender? I don't feel any nodules. No bumps. Okay, I'm gonna get you to lift your shirt up, just like this. There you go. Nothing crazy. I don't notice any skin blemishes, no discoloration. His skin looks good. Yeah, I don't really notice anything. Now I'm going to inspect and palpate for tactile fremitus and symmetry. So I'm gonna put my hand on your back and now say 99.
99.
Okay, it's resonance, the vibration's equal across. Say 99 again.
99.
Hold up, say it again.
99.
Okay, good, good. Now I'm gonna percuss over all the lung fields. Just do that. There you go. Alright, we're gonna turn this way so the camera can see all of this. Okay, now I'm going to percuss the costovertebral angle for flank tenderness. So tell me if this hurts. Hold up.
No.
No pain. I'm going to do, oh, I just fell. I'm going to do the other side. Any pain? Okay, now I'm going to auscultate the breath sounds. Alright, breathe in for me. Alright, breathe in for me. Okay, you can lift your shirt down. Alright, now I'm going to, we're going to face this way. Okay, now I'm going to inspect and palpate your upper extremities, which is your arms. Any of that painful. Okay, we're going to do the other side. Any of this painful, no tenderness, no pain. Alright. I don't notice any skin breakdown, any skin discoloration. He's a little red in the forearms, but that's expected. He's out in the yard a lot. Yeah, I don't really notice anything. Any nodules, any lesions. Does have a slight cut right there from possibly just a minor injury. Okay, now I'm going to palpate your radial pulse. Now I'm going to palpate your ulnar pulse. Okay, now your brachial. Okay, now I'll do your other side. Now I'm going to do your ulnar. Okay, now your brachial again. Okay, now I'm going to assess his capillary refill. It's less than 3 seconds. Capillary refill less than 3 seconds. All his pulses that I checked were a +2, which is normal. And now we are going to do range of motion exercises.
Okay.
So I'm going to get you a copy of me. We're going to lift your hands up in the sky.
Oh.
There you go.
Okay.
Now we're going to go behind your back.
All right.
Okay. Now we're gonna go back where I'm at.
Okay.
Now we're gonna, there you go. Which shoulder's hurting you?
My right one.
Right shoulder, okay. Go right down. Alright. Now we're going to stay our hands like this. Okay, now we're gonna flip. We're gonna pronate and supinate our forearms. There you go.
Okay.
And now you're gonna pull it back to you. Okay, back out. And now you're gonna pull back, but I'm gonna pull to resistance.
Mm-hmm.
Pull back to you. There you go. Now push. There you go. Alright, now we're going to the wrist and the hands. So now I'm going to get you to put your hands down. Okay, put your hands up. Okay, good. Now I'm going to get you to do a fist. Okay, now out. Put your fingers. Spread them. Go back in. Okay, now spread them again. Flip your hand over. And now touch your thumb to each finger. There you go. And now what I'm going to get you to do is I'm going to get you to take one finger and touch your nose. There you go. Now put it back down. Now do the same thing with the other hand. There you go. Put it back down. Now, oh, I'm sweating. And now what I am going to get you to do is we're going to do this thing called I butcher this every time I say it, graphesthesia and stereognosis. So we're going to do graphesthesia first. So close your eyes and hold out your hand like this. And I'm going to draw a number and you're going to repeat it back to me.
2.
There you go. That's graphesthesia. It passes that. Now we're going to do stereognosis. So you're going to close your eyes again and hold up the hand again. Now I'm going to put an object in your hand and you're going to tell me what it is.
A screw.
There you go. Alright, now I'm going to test the reflexes of his arm. So to do that, I'm going to take this instrument. I don't really have the reflex hammer, so this is what we're going to work with. Or either my knuckle, one or the other. So I'm going to test your tricep reflex first. I'm going to get you to hold out your, oh,
Okay.
it's kind of hard to do. I'm going to try to hold it for you.
Okay.
Alright, just relax.
Alright.
I'll hold it for you. I'm going to hit the back of your arm. There's a little movement. It's kind of hard because this arm's a little sore. Now with this one, you're just going to let your arm dangle.
Okay.
Slight movement of his arm when I do that. And now I'm going to, that was the tricep on both arms. Now I'm going to do the brachialis, which is down here. Just gotta find it. Right there. Alright, just relax. Let me hold your hand. You ain't even gotta do nothing. His fingers are slightly twitching. That's what you want. And now I'm going to do the same thing on this arm. Just relax, I got you. Fingers are slightly twitching, that's expected. And now we're gonna test the bicep reflex. So I'm gonna find the tendon right here. And I'm just gonna get you to just lay your arm right there for me. Just lay on my arm. You ain't even gotta do nothing. I'm gonna lift up your sleeve. I got your tendon, so yeah, just hold that. Alright. Looking for like a bicep twitch right there, which we got. Just took a while to get it. Now you're doing the same thing on this arm. Just gonna get you to rest your.
Okay.
Just gonna get you to rest your arm gonna find that tendon. Yeah. Alright, so all those reflexes were normal and was normal responses. So now what we're gonna do is I'm gonna assess the anterior chest while you're lying down, okay? So I'm gonna get you to lie down on this hospital bed.
Which way do I need to
Just lie down on that pillow.
On the back, my back?
Yeah.
Okay.
Okay. So I'm going to inspect and palpate the chest. Let me get this away from everybody. Alright. Any that hurt? None that hurts or pain. Alright, so I don't feel any nodules, any type of things that are sticking out the skin or anything like that. I'm gonna get you to lift up that so I can see your chest. Okay. I don't see any skin blemishes, any breakdown, any type of skin discoloration. He's obviously got hair on his chest. It's normal. Okay. Now just breathe for me. Okay. He's got symmetrical breathing. His breathing looks good. Now I'm going to palpate the point of maximal impulse for heaves, thrills, or abnormal pulsations. So that's fifth intercostal space. Okay, it feels good. Now I am going to auscultate with the diaphragm of my stethoscope each one of the points of the heart. So first we're going to do the aorta, then I'm going to do the pulmonic, and then the tricuspid, and then the mitral. Okay, now I'm going to do this again with the bell of my stethoscope. The same region, same points. The aorta. Then the pulmon. Then the tricuspid. And then the mitral. Okay, looks good. Now, I am going to do the abdomen, okay? So, I'm going to inspect the skin of the abdomen. I'm not going to touch it or nothing yet. I'm going to inspect the skin. The skin looks good. Obviously, he has a surgery next to his umbilicus. What might that be, sir?
It's a hernia.
Okay. And did you have surgery for it?
No, I haven't.
Okay. Now I'm going to inspect the abdomen. I'm going to look at the contour of it. The color looks good. He's a little pale there, but he's just got like that garden tan, farmer's tan. And yeah, I'm going to look for visible peristalsis, pulsations. Yep, it looks good. I don't see any visible peristalsis. I don't see any abnormal pulsations. I think I see his aorta pulsating, but other than that, I don't notice anything abnormal. Alright, now I am going to auscultate with my diaphragm, starting at the right lower quadrant, and then move my way up and like that. Don't know if y'all can see that, but okay. Okay, he's got normal active bowel sounds times 4. Now I'm going to auscultate his renal arteries bilateral and his aorta, which the aorta is like in the center. Okay, sounds good. Renal artery. Okay. Now, I am going to percuss the 4 regions of his abdomen. Okay, now I'm going to do light palpation first. Feel for anything that might be poking out, any abnormal nodules or anything. I don't feel anything abnormal. Is anything hurt, painful?
No.
Okay, I don't feel anything. Now I'm going to do deep palpation. No pain? I don't feel anything abnormal. His abdomen is nice, soft, non-tender. Okay. Now what we're going to do is I am going to palpate his liver to see if it's swollen, which is not palpable. And now I am going to go to the lower extremities while he's lying down. I'm going to inspect and palpate his legs, which I really can't see his skin, but any of that tender?
No.
No pain? Do the same thing with the other leg for me. Okay. Now I'm going to palpate his popliteal pulses. I have to do one at a time. It's hard to feel it through jeans. All right. That's a +2. It's also a +2. Now I'm going to take off your shoes if you don't mind. Okay. Now I'm going to palpate his posterior tibial. That's a +2. And do the same thing on the other side. It's also a +2. Now I'm going to do the dorsalis pedis. Okay, that's a +2. It's also a +2. Now I am going to look for pretibial edema. Push down. It comes right back up. No edema noted. Okay, now I'm going to do range of motion. So I'm going to get you to lift your legs up in the air 90 degrees toward the ceiling. So like straight up.
Both legs?
Mm-hmm.
Ain't no way I can do that.
Okay, well then we'll just do one leg at a time. There you go. Alright, good. Now do the same thing with the other leg.
Okay.
There you go. Alright, now lift it up again and bring your knee to your chest.
Both of them?
Mm-hmm. And put your knees outward, like away from you. There you go. Now put them back in.
Okay.
Alright, good. Alright, now put your legs back down.
Okay.
Now twist your legs in and out. Yeah, like that. In and out. There you go. There you go. Alright, now we're going to do your feet. So I'm gonna get you to, I guess I'm just gonna keep getting you to copy me. I'm gonna get you to flex your foot like that. Alright, now do that. There you go. Now invert and evert your feet like that. There you go. Looks good. Alright, now I'm going to get you to do the same thing where you pull them towards you. I'm going to pull them down. Alright, good. And I'm going to do the same. Yep, there you go. Looks good. Alright. Now what we're going to do is I'm going to test your reflexes. I'm going to test your Babinski, your patellar, and your Achilles. Sorry, my fault. Alright, to do this, I am just going to run my finger on the bottom of his foot. Actually, let me get this thing. My finger just doesn't, it's just not going to do it. Might have to get your socks to come on because you don't seem to be affected by this. Alright, let me take your sock off. Is that not ticklish at all? Okay. Now I'm going to do the other foot. Okay. Now I'm going to get you to hold up your leg, like just one of them at a time. Yeah. Okay. Now I'm going to do the other leg. Okay, that's good. Now I'm going to get you to hang your legs off the couch. So you're just going to have to hang your legs off the couch. There's really no, I don't think there's a way to do that to assess your patella unless you're hanging your legs off.
Okay.
Actually, we're going to get back in the chair.
Think so?
Yeah, we're going to get back in the chair because you can hang your legs off without me having to like hold them for you.
Okay.
Okay. Alright, now just relax. Relax both legs. Alright, looks good. He had a reflex to every single one of them that was normal. His Babinski was a little weird, but he had moments where it would curl up and other moments where it just wouldn't do anything, so it's normal. So now I am going to get you to lay back down. I know it's stupid, but
Okay.
it's just how the room is right now. Alright, lay back down. Now get your heel and like rub it on your shin like that. Like go up with it. Alright, now do it with the other foot. Alright, cerebellar functions great. Alright, now I'm gonna get you to stand up. This is the fun part.
Okay.
Now I'm gonna get you to walk on your heels.
Okay.
Just a few steps. You feel like you're gonna fall. Just walk on your regular feet. You know, or I'll catch you. There you go. There you go. All right, now walk on the toes of your feet, like you're tiptoeing. There you go. Now we're gonna do a Romberg test. This one's a little weird, but maybe you'll catch on quick. So we're gonna just keep your feet like this. There you go. Now we're gonna get you to close your eyes, and I'll count to 10, and you'll just stand there for 10 seconds trying to balance. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, you can open your eyes back up. Now I'm gonna get you to do semi-tandem, so like kind of put your foot like a little bit in front of it, not too far. There you go. Now I'm gonna need you to close your eyes again, try to maintain balance. I'm gonna count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, open your eyes. You feel alright?
Yeah.
Okay, now put your foot all the way in front of you.
No.
Yeah, no, that one's a little tricky.
Okay. Here we go.
Alright, close your eyes and count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright,
Okay.
alright. Now this one's, alright, I'm gonna get you to stand on one foot and hop.
Okay.
Alright, there you go. And do the other foot. You're doing great, you're doing great. We're almost done, I promise. I'm gonna inspect and palpate your spine.
Okay.
Okay, so just now lift that shirt up for me. Thank you so much. I'm gonna make sure it's symmetrical. Yeah, painful. Alright, it feels symmetrical. I don't feel any swelling. This vertebrae feels good. Alright. Now we're gonna range of motion of your spine, alright?
Okay.
So I'm gonna get you to kind of try to touch your toes the best of your ability. This is a range of motion thing. And your spine is still straight. Okay, good. Now we're gonna get you to kind of bend back a little bit. There you go. Alright, now we're gonna twist our shoulders. So twist, twist, there you go. And now kind of do like a little, Yep, you're doing great. Oh, almost just failed. Alright, that's it. So, you got any questions?
No, I think I'm good.
Alright, I'll let you know. I'll come back in here after the doc sees you, okay?
All right, thank you.
Of course.